Raheem, go ahead and stay on as well. Since you got us started on the discussion, stay in it. Okay. Jessica, let us know when we're ready to go back live. Hey, thank you guys for your patience and sorry about the technical difficulties there.
We understand.
Yeah. Take it to the head, not the heart.
So is Kenny and
Kenny McMorris is not going to be joining us this evening. We're gonna get him on in the near future
I
to
think
talk
we're
about
live
that.
now, Tim.
What's that?
I think we're live now.
Okay. Hey, welcome back, you guys. Welcome back. Hey, Jessica, our executive producer, since we're kind of having some technical difficulties, go ahead and instruct us. Just come on and instruct us what you need us to do verbally. And that's okay. Yeah. Hey, Raheem, you kind of set the stage for the conversation this evening when we're taking a look at this is April is cited as Minority Health Month, and so with all the things that we're dealing with, I mean, I think it's Russell and Josie. I think it's a spirit, mind, and body kind of thing. There's a lot going on that's affecting the body and the mind and the soul. So as both of you look at really the state of health, particularly minorities, people of color, what is resonating with you, Josie? What comes to mind in terms of what's as the state of minority health, particularly people of color, African American, Latinos, and so on. And then and Russell, if you could give your thoughts about that as well.
Yeah, well, first, I just want to say thank you for inviting me. My name is Josie Rodriguez, and I am the administrator of the Office of Health Disparities and Health Equity at the state of Nebraska, so DHHS. I have been there for, gosh, I've been with the state for many, many years. So I'll just say many years because it's been quite a while. So I just want to start with that. But, as we think about the state of minority health, I think about how much work people ahead of us did and where we're at today, and not much has really changed. Some things have gotten worse, some things have gotten better. And we do a lot of reports in our office, and we actually did a health disparities report, and we have 3 5-year trend data, and we see it go down, and we see it go up. And so all in all, we still are seeing a lot of disparities among our minority populations compared to whites. And so that's unfortunate. As I said, there are some better areas, but I think, Raheem, you had mentioned, the infant mortality rate among African American is two times that of whites. And, as we think about the homicide rate, especially in African Americans, that's high as well. And our Latino and our African American and our American Indian populations have high rates of diabetes. So we're seeing a lot of disparities there. And even as you said, Raheem, in COVID, right? We saw a lot of disparities in COVID among our minority populations. And so, I like the theme of moving to action, of the show, because that's what it's about, right? It's going to take all of us to take action about this. And we've tried to do that for so many years, but really, what are things that we can do? And I think we can continue to have the discussion, but I think it's really about addressing those structural barriers that you kind of talked about, Raheem, is looking at what is it, keep asking ourselves, what is the root cause of these structural barriers, or what are the root cause of these disparities, and really getting down to that level and taking action on that. I'll let Russell chime in a little bit.
Yeah, Russell, what do you think is, based on our past, what's the condition of minority health in America?
I think that it hasn't changed, man. It's just known more so now. But I've been saying this for the past 50 years. When I stopped playing pro ball, that's when I got into this, and I looked at the whole picture, looked at how we eat foods. If you look up all the types of foods that's out there, especially meats, it causes cancer. Bottom line, you got all the breads and sugars foods out there, it causes diabetes. You got our kids eating foods, sweets, first thing in the morning. at an early age that brings along diabetes. So I think what really needs to be done is education with our people about the proper ways to eat, the proper foods to eat, the foods to stay away from. And I think that's going to be it. I think that I also think that if people in Omaha, with all of the backyards that they have and all of the empty lots that they have, they can grow their own food, grow organic food, have their own farmers market, feed people proper foods instead of depending on going to the store and getting garbage. But I think the education is going to be the key. The so-called food stuff that they got us eating now is not the truth. The food is out there, GMO food. It's not real food. When they get food, they cook it so it's dead food. So I have an approach that's much different. Detoxify the system. Mm-hmm. You have to be in accordance with nature. If you're not, you're off. Your brain is off. When you eat live foods, you're raising the live. When you eat dead food, you're raising the dead. It's harder to raise dead than it is to raise live. So my whole thing is getting people to understand what foods there are out here, what foods are the best foods for their particular issues, get on those foods, but at the same time, detoxify all that old waste of residues in the system that feeds on, that the body feeds on, that causes these issues. And
so
we'll get into that a little later on. But I would love to come into town once a month, man, just to teach people the proper ways of getting these things done. Because the way that's going on, you depend on drugs. Drugs don't heal; they kill. Bottom line. So if you put toxins into the system that's destroying other parts of the body, like the kidneys and the liver, which are very important organs, I mean, we're not getting healthy.
Indeed. So you guys mentioned some really good things. So Josie mentioned a lot of the, the outcomes that are, observed within minority health. So your diseases that reduce your quality of life. And Russell, you mentioned a lot about how the perseverance, how you prevent a lot of these illnesses, measures that you can take to get these things together. So along those lines, I want to, ask an additional question. So as we look at how we can improve public health and health for minorities, let's get a little bit more to the weeds. So what's the work? What are some of the action steps that, people must take that not only elevate the game, but to improve minority health, reduce health disparities, and increase health equity?
Josie, you can have it.
Okay, thank you. There's many answers in that question, right? So I think that what we can do is I think Russell has a very good point. It is about eating the right kind of foods as well. And unfortunately, sometimes if you don't have that garden in the back of your house and, in your lot, they're expensive, right? Vegetables and all the healthy stuff can be really expensive. And so being able to have those community gardens available for our individuals, I think are great. And providing them with that education is great as well. I also think that, we have to have safe places to walk. A lot of times people don't have those in their community. And we're talking about racism here, right, too. And the structures that have been built in our society, as you think about some of the states, and I know we're talking about Nebraska, but if we look at the bigger picture, when they were putting some interstates in a lot of these southern states, they moved a lot of people away, and they had to move to places, and maybe some of those places didn't have safe places to walk. And if you really compare some of our communities and you look at a more dominant white community, how many lights there are, how many, maybe even wider sidewalks there are, how many bike paths. And when you actually go to a lower income community, you don't have those types of resources. So I think that as we think about the diseases, the disparities, I think we also have to think of the things that impact those, which are those structural things, right? All those things that I just talked about, better jobs for people, transportation so that people can get to work and go to the park and do all those kinds of things. So I think we need to address those structural barriers as well. And I think one of the biggest things for me is about building power within communities. And I know that might just be a word, but I think that oftentimes that power is, when we think about money and we think about resources, oftentimes the money comes down from the federal level, then it comes down to the state level, and then it goes down to communities. And sometimes that's funneled through those certain groups, right? Just the certain groups, we'll do it at the state level. Sometimes we send it to the health department. So we have somewhat power over the health department because we're telling them what to do. The health department might have power because we're telling communities what to do. Are there opportunities for us to utilize that power between all of us so that we're all working together on these types of issues?
I like a lot of the things that you mentioned, especially with the environmental and the structural, and as you were leading into the facilitation of some of those policies from federal to local level. So I'm gonna follow back on that, but I want to ask Russell because earlier you were talking about education. So what's the work into that, and how do we use that to reduce health disparities and increase health equity? Because I want you to talk about the education process and post-education. So once I get educated, like how do I apply that in my real life world?
Re-education. We've been taught wrong. We've been told lies. We've been taught if you drink 8 glasses of water and if your bowels move once a day, you're healthy in the world. If you eat a meal, 3 hours later, your bowels are supposed to move. So if you eat 3 meals a day and your bowels not moving 3 times a day, you have a backlog of waste in your system. When you have a backlog of waste, that affects the whole body, especially the mind. You can't do anything properly unless you get your physical self together so that your mind can be pure and you can move ahead. All that other stuff doesn't mean anything. It starts with the individual to understand what's been done to them. Undoing that, at the same time, the whole mind thing changes. But if you keep eating the same garbage, keep eating the same drugs, going on with the same stuff is just going on. You gotta make changes to make things happen.
Hey, no. With that being said, Russell, I hear you, but as far as this whole concept of re-educating, right? The force of money and what drives the economy, like you said, the white bread, the commercial, the Twinkies, the cereal, the sugar every morning. How do we begin to turn that corner of that powerful force of money?
Education again. When you explain to people what they're eating and you explain to them that it's poison and it's not really good for the system and it's dead food, they'll experiment on their own with themselves. When they start making some experimentation and they start making some changes, they'll see things happen on their own. They don't have to listen to me. This is just what I've done over the past 50 years. Keep my health together. I've never had any kind of problem like heart disease, prostate, none of that, because I found out a long time ago the proper ways of taking care of the system. I applied it to myself, and this is what I've been doing for 50 years. I'm doing a lot of teaching now to expose the truth about how the body works, because most of us are very ignorant about how the body works. We think food goes in and it goes out. There's 1,000 different things that takes place with the food that people have no idea about. When you understand these things and you start making changes, then you start seeing different things happen. That's very positive.
Well, I don't know, for the ones that's just joining us, we're really blessed tonight to have Josie Rodriguez from the state of Nebraska, Department of Health and Human Services, and I call him a masterful herbalist, Russell Harrison. And so I just thank you too for taking the time. And there's a lot of work to be done. And I just think with what's happening right now with COVID-19 and just when you think about, and you talk, everybody's been talking about just its effects of environment. When you think of, can you break that down a little bit more? And then Raheem, I'll turn it back over to you, man, because I know you got some sauce that you want to add. But just the element, Josie, of what's happening to people, how is that affecting their health, and what might they do to really? What's some of the remedies that we can begin to guide them to, or information they can seek to improve their health? And the same with you, Russell. We talk about it. How do we get them to improve their health? And we most definitely can put you guys' information out there. But now it's about, that's why we call this moving people to action. How do we move people?
Josie can be first, because she's a lady.
Okay, I'll go. I think that when we talk about the environment, I think it's hard, right? Because there's, as I go back to racism again, there's structures that are already in place. So we need to really figure out a way how we can bring those structures down, right? And make changes to the way that decisions are made. Part of that, of course, is, as I go back to building up power, how can we put more individuals from the community with lived experiences in those positions of power at the city council level? I mean, it can start at any level to start making those hopefully changes within the community. But I also think that
Point on.
Yeah, I think there's opportunities also to think about. I think about the new economic development office that was opened in Omaha, right, earlier this week. That's a great thing to bring more things like that into communities that don't have those resources. That's going to bring hopefully a lot of good paying jobs to North Omaha. And then I know there's another thing going on in Omaha where people can sign up to take classes to, I think that'll help their business. And that will, I think, help them work with different organizations. So it's things like that that we need so that people can have those same resources as other people that may have more privilege, right? We talk about privilege within the community. So I think there's a variety of different things we can do, but another thing I think is really being involved in city council meetings, being involved in, health department meetings. There's a lot of health departments have these community health improvement plans. And as we were reviewing those, I was surprised to see, the low number of minorities that were involved in those efforts. And I don't know if it's because people can't attend when the meetings are being held, or if it's because there's not enough outreach going out to the communities to be involved. But I think just really take action, be involved in those types of events that are going to be able to give yourself a voice within that space.
Yeah, I think it's not enough outreach and being intentional. And we got to dig deep and work harder. But I love what you're saying about policy. A lot of these behaviors are embedded in policy. I think the same in terms of these racist policies. And one of the things, some of the work you'll see from MP to Action, moving people to action, is really beginning to start to shape an agenda around policy. Now, Russell, what do you mean by live foods in terms of this whole thing of? And I think when you think about policy with our schools, we got to start putting people in office that value health,
and provide the education,
and education that's going to create policies for better, healthier eating and more live foods. So, talk to me, Russell.
About live foods?
Well, in terms of just kind of what in the conversation of just action steps, where do we go?
Well, again, it goes back to education, and again, all that other stuff that you're talking about changing policy, it's not going to happen until you start with people first. People have to come first with their education, with a mindset and a different mind change. Otherwise, the same thing is going to be going on. That's been going on for the past 20 years. The same thing is going to be happening now. What I mean by live foods? Look at every other form of life on the earth. They eat everything in a raw state. They don't have the health issues that we have. When you take that live product and you cook it, now you destroy the live enzymes, which are body building and protective enzymes in the system. So it goes back to, you eat dead food, you're raising dead people in the mind.
Wow. Raheem, he said a lot right there.
Yeah, he said a lot,
He's going to have me changing my habits.
You should have been changing your habits, Tim.
No, Russell, you're absolutely point on. And I'm a work in progress, just like many folks out there. And I do have to challenge myself to do better, because it really is, if you want to live and live long and live happy, it is about what your intake, it's what you put in. When I don't know, I hear this all the time, Russell, and you guys, that weight management, it's about 20% is physical in terms of what you do as far as workout. 80% is what you put in your mouth. You're on mute. Russell, you're on mute.
Okay.
There you
So,
go.
so if you're putting it in and it's not coming out, that's weight gain. Bottom line, you're putting food in and your bowels should be moving 3 times a day. If it's not, that starts a backlog. Now the backlog starts in the colon, then it goes to those filters, the liver. And the liver is attached to every part of your body. Filters need to be cleansed as well. People don't think about that. It's almost like your automobile. When it starts getting sluggish, you take it in, you change the oil and the oil filter. Your liver is the oil filter. Your blood is the oil.
Mm. Now,
So that's part of the education that we talk about. When you teach the proper ways, people start to think a little bit different what you put into your system. If it's going to affect your body and it clogs the system up, you're asking for trouble.
right on.
So when you put when you put live substances, when you put the live foods into your body, it absorbs into the system and then it's eliminated. Nothing's held in there to rot inside your system. I mean, you got people that bowel move once every 2 and 3 weeks at a time, which is horrible.
Now that's dangerous, and they're bagged up.
And of course, they're backed up. Not just in the colon, but the liver and the kidneys and the lymphatic system and all those areas. And so basically, and it's something people talk to me about all the time. Russell, why you talk so much about bathing and moving your bowels and doing the liver cleanse? I tell people all the time, you take a bath every day, but you don't clean your insides.
Yeah, right on. Hey, let's take a break, and then when we come back, let's wrap it up in terms of Raheem. I'll let you bring us back in terms of just making sure we get pointed about some of the questions that we want to make sure we give you guys to answer before we wrap up this town hall meeting tonight. So we're going to take a short break, and Jessica, take us out, and then we'll come back in for the last segment.